Today I'm going to be talking to you about tokophobia, what it is and what you can do about it. My name is Dr Emma Svanberg and I'm a clinical psychologist specialising in the perinatal period. So what that means is that I work with people through pregnancy, birth and the early years of parenting. Tokophobia essentially refers to a fear of childbirth, although that can also extend to include a fear of pregnancy itself. We know that it affects around 14% of women, although we also know that that figure is increasing for various different reasons. I'm not talking here about anxiety around pregnancy or childbirth, which affect most people in some way. I'm talking about a really significant fear which can really impact on our enjoyment of pregnancy or even whether we're going to get pregnant in the first place at all, and can leave us very anxious about the birth itself. When we're talking about tokophobia, we divide it into two different types. So primary tokophobia refers to that intense fear occurring when we haven't actually given birth ourselves already. So that might come because we've heard really difficult stories about other people giving birth, or there might be other reasons why we have this intense fear of childbirth. Whereas for secondary tokophobia, usually that occurs in people who've had a difficult or traumatic birth experience already. It's important to differentiate between them because we might offer different interventions depending on your previous experience. For example, if you have tokophobia in your first pregnancy or before you've become pregnant, we might treat that as more of an anxiety problem, so thinking about things that we can do to reduce that anxiety. Whereas for secondary tokophobia, that might be linked to symptoms of post-traumatic stress. So it's really important that we deal with those symptoms before we can then hope to reduce the symptoms of anxiety. If you are listening to this and you're experiencing that significant fear around pregnancy or childbirth, the first thing to remember is that there is absolutely nothing to be ashamed of. We develop these fears and anxieties out of very real and important experiences that we've had. And what we can often do is diminish them or invalidate our experience, and that can stop us from seeking support. But if you are experiencing this fear, it's really important that you seek support as early as you possibly can so that a support system can be got in place to help you enjoy your pregnancy and hopefully have a satisfactory birth experience too. There are a few different ways or approaches of treating tokophobia, and often people might draw from different approaches. So that might be a mixture of talking therapy, you might have some alternative therapy, some people also find medication helpful. If you go first of all to speak to your GP or your midwife about how you're feeling, then most trusts now have a different pathway that you can follow depending on your level of anxiety so that you can get the support that you need. So often you might see somebody like me, a clinical psychologist, you might also see a specialist mental health midwife, and different approaches can be put in place to help support you through your pregnancy and as you approach childbirth. So what this means is that you'll be offered a few different approaches, which might include both emotional support, but also support in helping you make practical choices around your pregnancy and birth that can help you reduce your fear. For more information about this or anything else that comes up in your pregnancy or birth planning experiences, please do have a look at your baby club for more information. Bye for now.